I run services in Wandsworth for people coming out of psychiatric acute hospitals, or people that maybe have had issues to do with substance misuse and are struggling in the community or street homeless. Run 6 different projects. The one we're in now is probably our highest support accommodation. And that means that while often staff are on their own, the building is covered 24/7. So we normally have support staff working in the day, and overnight we have what's known as a night concierge, that somebody sort of manages the building security side of things from about 9 o'clock at night right the way through till about 9 o'clock in the morning. We have 11 clients in this building. 8 of them are male clients, and we have a 3-person female corridor. What tends to be the case is people have their own rooms on the corridor, but they share cooking and kitchen facilities. I jokingly tell students that who come on placement that actually supported housing is a sort of mixture of social work and running faulty towers. So it's a bit like you have to be good at the support function and all the value base of practice, but you've also got to be pretty good at the hotel management side of it. You can have the most caring service in the world, but if you're half empty as an organisation, you'll go broke. I'll show you a room that we're about to relet. Not the most picturesque of settings, because all the furniture is piled up, because what we do is we repaint a room, particularly if somebody's been living there for quite some period of time. And then we would normally work with contractors to get carpets cleaned or replaced or something. So this would be a typical room, one of the rooms that we would relet. As you can smell, it's the fumes of paint. It's just basically been repainted.
Light on?
Yes, sure.
It's a sort of one room, and there is a sink,
Yep.
window, little fridge.
Yep.
Yeah. Everything will be tidy and neat. Looks nice.
Yeah, this is one of our nicest rooms in terms of sort of space, but needs a little bit more work done to it. I mean, what normally happens is we get people to come in and clean and also do the sort of painting and so on. Particularly if somebody might have been living in this room for 2 years, there might be a smoker. So it's, I think it's nice to give people a sense of being valued. It's actually quite important that you don't let property in a state which makes people feel that it's been knocked together. People have a right, I think, to a reasonable quality of accommodation. Particularly if you're not feeling great about yourself, there's nothing worse than sort of being moved into a place that's looking shabby. And I think the way that you let property to people is a clear indication of a value of care towards them. And I think that's sort of something that's quite important to us in supporting housing. Okay, and here we have a typical office environment. And as you can see, our student, who's vacated the office just temporarily, is sitting here with the Social Workers in England handbook on the desk. I mean, I've been a social worker since qualifying in, 1990. And I'd worked mainly with young people services. But it was in 1997 that I actually became sort of unwell myself. Quite an embarrassing period, because 1 minute you're supporting clients and you like to believe that you're wonderfully professionally in control, and you're supporting people who have the problems. And I became extremely unwell for a whole range of reasons, and had a period of time in hospital in an inpatient setting. And it was an interesting culture clash. For 1 minute I was sort of providing residential accommodation, and next minute I was on the receiving end of it. And I think that sort of still influences a little bit of practice, because I have a lot of friends I made at that time, and actually, ironically, being a client in a service can be quite a bonding experience. I still have friends who I remember were on the same acute ward as I was at that period of time in our recovery. So it's obviously quite a dramatic time, because of, you're all in a pretty difficult situation. So for me, I think it was that sort of transition from being a professional with all this, and then suddenly finding myself And I think at the time, probably it felt undignified. I think at one period, a brief period of time, I actually had a social worker. And then actually and sometimes it could be difficult to ask for help when you're in a culture of providing it. I'd been extremely unwell at that period of time, so it took a little longer in terms of recovery. I did a lot of work around patients' rights groups, advocacy work. We ran, say, drop-ins that were on acute ward sites so that clients could come in and get help with maybe appealing a section, negotiating Section 17 or day leave was really important. And I worked for about a couple of years as a volunteer, and then my first job back was solidly within service user involvement. I worked on a project with the Sainsbury's Centre for Mental Health in London, which was to train up people that had first-hand mental health experience to design questionnaires, to interview other people that had used psychiatric services, to produce a set of recommendations based on the quality of their experience, and then actually to devise a training program to do some work with frontline staff, at that time mainly nursing staff, to actually improve the quality of care. And that was quite a exciting job. It was about sort of getting, it was nice to see so many other service users, as I was still myself, on a road of recovery, who, that sort of project gave people something to get up in the morning for, had a value in terms of improving services, and quite a few people moved on from that to get back into work, and it gave people the sort of confidence to move forward in their life, and as it did with me. And then I worked for getting on for 5 years as a service user manager. I had a team working in acute care, psychiatric services, across a whole range of areas for a big mental health trust in the southwest of England. So I think when I'm actually running a supported housing scheme, I have to sort of remember what it was like to be on the end of a service. Say you're desperately wanting something one day and coming up to somebody and saying, a member of staff, and saying, oh, can I just get you for a minute? Oh, I'm sorry, we're in handover. And then finding that member of staff never got back to you, and you were just left with that anxiety, or you asked somebody and they said they'd get back to you, and then next minute you found they'd gone off on a week's leave. I think I remember to keep promises to clients. I think that's quite important. But I also lived in supported housing for 3 years prior to, so partly I'm managing a project where I could have been actually living. And I just think it's partly remembering things like just how disorientating it is to come to a new project for the first time when you're not unwell, or when you're not well. Also the fact that it can be very lonely, so actually thinking about opportunities. If you're not feeling confident and you're suddenly placed in this housing, and so what will actually bring people together. I always think like loneliness is the common cold for most mental health difficulties. It's people's sense of isolation, and often that sort of I'm not feeling very confident, I've just had sort of a severe depression, I find it difficult to mix outside anyway, because I'm worried about sort of people's reaction to me being out of work and what am I going to say about my history and all that sort of stuff. So actually building support structures within your accommodation service is really good, that we sort of reduce isolation, and slowly, as part of supporting people, giving people help from being able to move out into community settings, I think is also important, because while coming into supported housing for me as a client was quite difficult and disorientating, and I'd been in hospital several months before that happened, I think my next movement was actually moving out into the community, which was really difficult, because I'd always had people around me until then, people's different shared rooms and flats. We might argue and have disagreements and have all the sort of squabbles of communal living, but you had somebody around you to squabble with. And I think actually we sometimes need to pay more heed to that in supported housing. I think because all of our outcomes are, get somebody their own box, and that's fantastic. It's a planned move on. They've been independently accommodated, and I get lots of plaudits as a manager. But actually, for a lot of people, it's about that communality. It's about shared life experience, which actually keeps people well. And I still think we've got a little way to go. That was important for my well-being. It was actually, I think, eventually I got back into work. Well, that was great because then I had other people to interact with, a sense of self-esteem. Somebody asked me, what do you do? I was able to tell them something, whereas before, I'm in recovery, I'm going through a period of illness. And you almost had to think of an explanation as to what your purpose was. So actually, self-esteem, giving somebody something valuable to do, looking at work opportunities, and remembering that loneliness is a sort of real issue for people in supported housing services, I think is some of the core lessons that I've taken away from my own experiences of using them. People are very, very depressed or have been in a long-term cycle of using services. I think you can start off with the best intentions of the world as a student. Hello, I'm really out here to help you, and you have a wonderful task-centered thing planned, and then you find that people are reluctant and keep missing appointments and generally undermining what you think is a really good piece of work that you could be doing as a social worker. Some of the things that come out of that approach, which is around mindfulness-based awareness of your own feelings rather than getting tangled up in thoughts, actually becomes quite important for students to be aware of. If I've got a client who I've started off with the best intentions in the world to help, and there's just nothing is working, you end up with lots of feelings of your own frustration and stuckness, and that can very, very quickly start to affect behaviour. So in counselling, you normally get asked the question, what came up for you when working with that client? And I sort of do try and introduce an element of that in students, because I don't like students who are very, very enthusiastic suddenly to burn themselves out by having to sort of secretly deal with all these, I should be valuing and non-oppressive, but this client is really, really frustrating. Also, you can hate your client, that's fine, as long as you behave in a way which is professional and valuing. And it's possible to have strong feelings of loathing and actually still do a good job. But it helps to know that you have those strong feelings of loathing, because if you don't, what's going to happen is that's going to start affecting your behaviour in professional practice. So I do a lot of work with students around, they'll often say to me, what do I do, Ross? This client, I've done this, I've tried my humanistic approach, and I've done my task-centred approach, and I've introduced a little bit of CBT, and nothing's working. And actually, I think sometimes just being able to be with that stuckness can be quite helpful. And actually, sometimes the less you do with the client, it's a bit like, a therapist once said to me, it's sometimes good to see your client as a sunset rather than a maths problem that you have to solve. And I think that's quite important as well, because often when I get stuck with a client, I tend to sort of overwork it, and okay, well, you don't want to do this, but what about this, or this fantastic, recovery centre that's around the door? And actually what you often find is that you're sort of racing after the client, coming up with 101 solutions, all of which are being turned around. So sometimes just being not comfortable, but being able to sit with what's coming up with you as a practitioner is really important. And that's where you begin to get that sort of elements of sort of mindfulness coming in, and actually being able to have a little bit of distance from your professional frustrations that allow you the space to work in a professional way. And I think that's quite important in most of the times when things are going wrong. Social work students or support workers, it's people who are dealing with really strong and difficult emotions and actually not having that level of distance to act professionally.